Hi, welcome to my Ed Talk. We're going to be talking about potassium-sparing diuretics. Let's get started. So we use a couple of potassium-sparing diuretics. However, we're going to focus on spironolactone because that's what we're going to see the most. How do these potassium-sparing diuretics work? We're going to basically, when you give one, it's going to inhibit sodium-potassium ATP paste pump in the late distal convoluted tubule. So here's the distal convoluted tubule, the late part, and as zoom in here, you see the sodium-potassium ATP paste pump. And what potassium-sparing diuretics are going to do is they're going to inhibit this action. So that results in a sodium excretion while reabsorbing potassium. So you're going to get rid of sodium and you want to keep potassium. And that's why it's called a potassium-sparing diuretic. Now, spironolactone in general is actually also a aldosterone antagonist. So aldosterone is a hormone that when it's bound, it's going to promote the excretion of potassium and exchange it for sodium. So it's going to want to get rid of potassium and keep sodium. And by keeping sodium, water is going to be retained because water will follow sodium, right? But spironolactone, he's like, no way. This is how it works. He blocks aldosterone from doing this action. So instead, it kind of gets reversed. You get sodium out and potassium is retained. Okay? And that's how spironolactone works. So let's talk about why we use it. So spironolactone, because it works on this late distal convoluted tubule, it doesn't do a lot of good diureses, right? It's actually weaker than the other ones. So what we do is we actually use it in conjunction with the loop and thiazide diuretics to help decrease potassium loss. A lot of the times you'll see this to help treat heart failure and hypertension as well, helps to decrease edema. And because it's an aldosterone antagonist, it's also used in hyperaldosteronism. Net effect. So it's going to, potassium-sparing diuretics are going to help with natriuresis, which means it's just going to get rid of sodium, and diuresis, get rid of water, but it's going to preserve potassium. So what are our side effects? So side effects of potassium-sparing diuretics, specifically spironolactone, is you can get gynecomastia, which is basically breast tissue in men, and then libido changes. Adverse effects, obviously, because it's going to preserve or keep potassium, it actually can cause potassium to accumulate and you get hyperkalemia. And this is especially noted when patients are taking NSAIDs, beta blockers, or ACEs and ARBs with it. So things you want to monitor for. It's a potassium-sparing diuretic. So accumulation of potassium can cause dysrhythmias. You can see peaked P waves. So you want to make sure you check their serum creatinine levels and also look at their EKG, see if there's any potassium-related abnormalities in the rhythm. And finally, this is relatively contraindicated in significant renal failure. You want to monitor their renal function because obviously if they're having renal failure, they're having issues with keeping too much potassium in already, so you wouldn't want to be giving a potassium-sparing diuretic to a patient with renal failure. All right, thanks for watching. I hope that helps. See you next time for the next Ed Talk.